In 2012, we got the MedTap Healthcare Access Grant awarded to MetroHealth Medical Center and Case Western Reserve University. The goal of the grant was to recruit, train, and retain a primary care workforce to serve the Ohio Medicaid population, and we are about to begin our third year on the grant. Our first grant goal was to create innovative patient care models where we could plug in our learners.
One of the first things that we set out to do was to identify our most chronically ill patients and then get out into the community and visit these patients in their homes. Then we began to develop weekly group visits for these patients who had diabetes, COPD, and chronic pain. So leading these weekly group visits, we have social workers, mental health practitioners, and family physicians, as well as students.
So the next goal in the grant was establishing learner pipelines, and we worked with multiple professional schools throughout Northeast Ohio to create a learner pipeline for our programs.
You experienced relationship on a different level. You saw the relationship between the doctors and the healthcare providers and the patient. You saw the relationship blossom between patients and their shared experiences, and you saw the power of a group.
The next step we did was to create an elective called Innovative Primary Care for the Urban Underserved. We registered it through Case Western Reserve Medical School and advertised it on VSAS, and to date we've had a variety of learners. Our next step is to get the learners out of the tertiary care setting and put them into the community so that they can experience patient care from the patient's perspective. And we to date have created learning sites with patient care models in the school-based health clinics throughout Cleveland. We've also established a relationship with Arbor Park Clinic, which is in an urban underserved housing development. It's a clinic that targets the residents of that housing development. It was started by Case Western Reserve Medical School in conjunction with Care Alliance. And then we've also created a partnership with St. Malachi's Church to work at their shower clinic for the homeless, and we are offering a mobile healthcare team that goes to that clinic every Friday that is made up of a psychologist, a nurse practitioner, and a student, along with the MetroHealth benefits enrollment van, so that we can bring care to the homeless population at that site.
So it was during the time of first year when I was on the inpatient service and I was close to being burned out. And what I found was that it rejuvenated me because I started to work with a population that not only had the same pathology as the type of patients we see here in Metro, but they also didn't have a place to live. So they really appreciated what I was doing for them.
One of the other programs that we have running is our Colocated psychiatry services. And this is where we have behavioral health services in the family medicine clinic. So the collaboration that occurs in this model is really great because you have doctors, social workers, and psychologists and psychiatrists all talking about the patient.
So our preliminary patient outcomes that we've been gathering from our group visits show that there's been an improvement in self-efficacy, depression, and anxiety scores, as well as a decreased utilization of hospital and ED visits. In terms of our provider and learner outcomes, for the providers, we're looking at physician burnout, provider satisfaction, and for our students, we're looking at learner attitudes towards working with the underserved. So I'm proud of the work that we've done to date, and I'm excited about our future. We plan on increasing our learner pipelines to expand the primary care workforce for Ohio. We're also working to make our programs as cost-effective and sustainable as possible. And then by going out into the community and serving patients where they live, we're hoping to create a more culturally competent workforce that can be excited about serving the underserved population in Ohio.